Tonight, Desert Regional Medical Center is continuing to see a record number of coronavirus cases, and the hospital is preparing for that surge to increase. But when it comes to the regular flu, the hospital has not had a single case all season. I spoke today with the Chief Quality Officer, Christine Langenwalter. Christine, it's good to see you again. Thanks for joining us.
Thank you, Peter. Good to see you again, too.
First off, what's the latest at Desert Regional?
The latest at Desert Regional is we are continuing to run between about 95 and just over 100 COVID positive patients that are in-house right now. We are continuing to see the surge and the numbers go up. We are continuing to prepare for what we feel may be an increase even further in the surge over the next few weeks. And we're working with local and county resources to figure out how we as a community are going to come together to combat this.
According to the graph we have showing the case numbers, there is a dramatic difference between now and just a month ago. What do you attribute to that?
You know, it's a good question. I think that the natural course of the virus may be such that as the weather gets colder and we're indoors more, that it's more likely to spread. I mean, we had a peak in July, and then I think everyone, as the months went on, it just got a little colder. The virus took over. We haven't seen any influenza cases despite us testing hundreds of people for influenza. But I think it's just the normal cold flu season and close proximity. And then you have holidays such as Thanksgiving, Christmas, New Year's, the time when people typically get together with their families and they're indoors more, and it's more likely to spread.
You just brought up something that I think is pretty significant. You have not had a single case of the regular flu this entire season. Why do you think that is?
I think, so sometimes the public thinks that the flu is a generic name for a runny nose or just not feeling well or a variety of other things. Whereas the flu is actually a virus. It's an influenza virus, has a specific name, and we have specific tests that we do for it. And those tests are all showing that it's negative so far. So why is that? Well, flu is spread the same way coronavirus or COVID-19 is, and that's through lack of hand washing, not sanitizing, coughing or sneezing in front of people. And those are all the things that we're all trying to really prevent and do well with. And so I think it's helping us with influenza.
You know, a lot of people might hear that and be a little confused because we're washing our hands, we're wearing face coverings. Why is that effective perhaps for the flu, but not effective for coronavirus?
Each virus and bacteria has a different virulency to it. So virulency is just how easily something is spread. So I think with coronavirus, you can have a lower viral exposure to it, and it's much more easily spread and contagious than necessarily, influenza might be. So I think that's part of it. I think the other part is that typically coronavirus hangs along a little bit longer than a typical flu does. And so you have a longer period where you can be exposing people than you might with influenza. So certainly just speculations that we all have, haven't been researching that in particular, but it's just a good observation in our community. And there's a lot of rumors out there, but we are testing for influenza and we are not seeing it.
How are vaccinations going so far for healthcare workers?
Here at Desert, we have an excellent team that spent many, many hours of preparation for vaccinations, as well as many, many dry runs. And they are doing extremely well. We have appointment slots for everyone so that we can make sure that people are coming in based on the tiers that the government has recommended, so that those frontline COVID workers and doctors are getting the vaccines first in the first rounds. And then they're spaced out over appointment times. And we, as many other hospitals, have been lucky to find that there is about 6 doses in some of the vials instead of 5. So we were actually able to vaccinate more than we anticipated. And that's perfectly acceptable by the CDC and the drug manufacturers as well. And we've gotten a second shipment this last week. So we feel that it's going very well. It's well organized. It's being well received. We have a number of people that are choosing to wait until another month or two to see how those that have gotten the vaccine are doing with it. But we're looking forward to getting our team fully vaccinated and then assisting the community and getting the community vaccinated as well.